Hey, my name's Chloe, and I'm going to be performing an intermediate bedside assessment. Hey, I'm Chloe. I'm going to be your nurse today. How are you?
Good, how are you?
Good. How are you feeling?
Good.
Great. Can you tell me your name and your birthday?
My name is Neely Sanford and my birthday is December 20th, 1996.
Great. You are correct. Can you tell me where you are today?
I'm at the hospital.
Okay, can you tell me why you're here?
I fell at work and broke my foot.
Okay. Do you have any allergies?
Keflex.
Okay, do you know what day it is?
It is August 8th, 2020.
All right. So my patient is alert and oriented ×4, and she has no allergies, so that is good. Now I'm going to get some vital signs on you. This is just a blood pressure cuff I'm going to stick around your arm. My patient is allergic to Keflex. I'm sorry. Yep, just raise that up. Make sure your feet aren't crossed and you're just sitting still. Are you in a comfortable position?
Yes, ma'am.
All right. My patient's blood pressure was 118/74, which is within normal limits. If I had a thermometer or a pulse oximeter, this is when I would be assessing for a temperature of above 100.4, or I would be also looking at an oxygen level to ensure that it's above 92%. So that's great. All right, I'm just going to feel your radial pulse really quick. I'm just going to count that for 30 seconds. All right, so my patient's radial pulse was 64, regular rate, regular rhythm, and her respirations, when I was counting along with her pulse, was 14, regular and normal. So that's a good sign. And this patient is on 2 liters of oxygen via nasal cannula. Do you have any burning under your nose?
No.
And can I look at the back of your ears to make sure there's no skin breakdown? And do you feel like your cannula is loose enough on your neck and you can feel it good on your ears and everything?
Yes.
All right, and my patient also has SCDs on her legs just to prevent her from clotting because she had surgery yesterday on her foot. And this patient doesn't have an NG tube or a catheter right now, so she's urinating effectively on her own and she's eating effectively on her own. Okay, so now I'm going to listen to her heart really quick and just listen to her afocal pulse, and I'm going to listen to that at the left midclavicular line in the 5th intercostal space. So if you'll just hang tight for me, stay still. All right, so my patient's apical pulse is regular and normal. I did not assess the rate of this because I just assessed the rate of her radial pulse. So now I'm going to listen to my patient's lungs. I'm going to listen to 8 spots on the back, 6 spots on the front, and 2 spots on each side. Do you have a cough or anything?
No.
Have you been short of breath?
No.
Okay, and she is on 2 liters of oxygen. So we're going to listen to her lungs really quickly. And I'm just going to have you breathe in through your mouth and breathe out through your nose. All right, if you'll lean forward for me. Okay. And I did not listen to all of the lung sounds, but the lung sounds I listened to for the purpose of this exercise were clear. There was no crackles, there was no rhonchi or anything like that. And you felt good breathing like that for me?
Yes.
Great, okay. And now I'm going to listen to your belly just to listen to your bowel sounds and make sure those are all good. And I'm going to listen to those in all 4 quadrants of her stomach. I'm just looking at her belly and it's not distended or anything before I start messing with it. Okay. Her bowel sounds were normal active in all 4 quadrants. Can you tell me the date of your last bowel movement?
Today.
Okay, and was it normal?
Yes.
What's normal for you? Brown? Is it like formed?
Formed.
Okay, great. And you said that today was the last time you've had a bowel movement, and it felt normal and all of that? Okay, great. And when's the last time you urinated?
About 30 minutes ago.
Okay, and do you urinate frequently, like all day long?
Yes.
Okay, and what color is that usually?
Clear mostly.
Okay, and it's not cloudy or anything?
No.
And it's yellowish maybe?
Something.
Okay, great. So just throughout the shift, I would just ensure that I'm monitoring her intake and output. I would make sure that I document everything this patient takes in, oral fluids, IV fluids, all of that good stuff, and I would make sure that I document everything that comes out, so like urine, and we would monitor like if she vomits or anything like that. So that's great. So now I'm gonna have the patient dangle her feet on the side of the bed, and we're gonna assess for mobility. And while you're hanging on the side of the bed, just to make sure your blood pressure doesn't drop on us, I'm just gonna hold your arms really quick. I'm just gonna do your wrist and make sure you can turn them for me. Can you do that by yourself? All right, and can you do this? Turn your shoulder right there. Can you do that by yourself? All right, and that one's good. And do the same with this one. Great, okay. I'm gonna take your foot right here, make sure your ankle has got good range of motion. Can you do that for me? And let me see this one. Does that cause you any pain?
Just a little bit.
All right. How do you feel? Do you feel like you can stand up?
I do.
All right, great. Just grip my fingers really quick, like this. Make sure you can grip them pretty good. All right, and I'm gonna take your feet and I'm gonna have you push onto my hands, okay?
Okay.
All right, push, 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 push. There you go. So this patient has full range of motion in all four extremities, and she's also got great strength in her hands and her feet. So that is great. So now I'm gonna have this patient stand up and make sure she can stand good. All right, do you feel like you have your balance? You feel like you're not gonna fall over anything?
No.
Okay, I'm just gonna have you walk over to this dresser right here and then come back for me. All right, now come back to me. And then sit down in the bed for me. Do you feel like it's easy to walk with the boot on your foot?
Yes.
Okay, and you feel strong to do that? You don't feel dizzy or weak?
No.
Okay, great. And this patient does have a cast on her foot because she had surgery yesterday, but she's not in any traction or anything. But if she was in traction, we would just make sure that her skin was good and all of that good stuff. Also, I've been assessing this patient's skin throughout the assessment, but just to look at her legs right here and where this cast is on her foot, we want to make sure that she doesn't have any skin breakdown. But she's up and moving around pretty good, so she shouldn't have any sores from laying in the bed. And she doesn't. Her skin is pink and warm to touch, and she's got good skin turgor, which means she's not dehydrated, and her capillary refill time is less than 3 seconds, which means that she's getting good blood flow to her extremities. So those are all good signs. And she has no lesions or scars or anything like that. And I'm just gonna feel for the rest of her peripheral pulses really quick. So I'm gonna feel this radial pulse again. And you wanna feel these bilaterally and symmetrically. All right. These are both 2+ bilaterally. So I'm gonna feel your brachial pulses. And this is also 2+ bilaterally. And then I'm gonna feel for her popliteal pulse. So this one's under her knee. Okay. And these are 2+ bilaterally as well. And now I'm gonna feel for her pedal pulses, which is important for this patient because we wanna make sure that this foot that has a cast on it is getting good blood flow. So a pedal pulse would indicate, a positive pedal pulse would indicate that this patient is getting good blood flow. Just gonna feel this one. So this one is 2+ bilaterally, and this one is also 2+ bilaterally, so that is a good sign. All right, we're getting close. Do you have any hearing problems?
I do not.
You don't wear any hearing aids? You feel like you're hearing everything normally?
Mm-hmm.
All right, so that sounds good. Do you have any eye issues? Do you wear glasses or contacts?
I wear glasses.
Okay, so I'm gonna just shine this light right here in your eye. Just don't be alarmed. So I'm gonna have you find a spot on the wall over there, and I'm just gonna do this, okay? All right, and then I'm gonna have you look at my pen right here. Great, and then I'm gonna measure your pupils. All right, so my patient is Perla, and her eyes are 6 millimeters, or her pupils are 6 millimeters. And I was just looking at her eyes, and her sclera and her conjunctiva are all in good condition. They're pink and moist and white and all of the good things that they're supposed to be. So now I'm just gonna shine my light into your mouth. All right, so her tongue is pink and moist, and the rest of her oral mucosa is also pink and moist, so that is a good sign right there. And so now I would just hand this patient her call light, and I would just make sure she didn't need anything. Do you need anything?
I'm good.
All right, and I'm going to make sure that the bed is in a low and locked position, and then I will see this patient in a little while.
Thank you.
Thank you.